Healthcare evaluation in public health. What is healthcare evaluation? Healthcare evaluation is the process of systematically reviewing and assessing our current healthcare policies and practices with the goal of improving them and basing them off current research and new data. Healthcare evaluation is vital for measuring effectiveness, quality, and efficiency when it comes to our current healthcare practices and policies. In simple words, evaluation tells us what works and what does not. Ongoing healthcare evaluation is essential for maintaining healthcare policies that are up to date and that provide the best chance for our patients in order to have good health outcomes. Evaluation plays a critical role in healthcare improvement by ensuring that interventions and programs deliver intended outcomes. Again, without healthcare evaluation, there is no way to know whether what we're doing works, and there's no way to improve our healthcare practices in order to change what we do as new research comes out. Healthcare evaluation improves healthcare quality, supports accountability, guides resource allocation, and promotes evidence-based practice. As much as healthcare evaluation is hugely important, there are a variety of challenges that can be faced when it comes to healthcare evaluation. Data quality issues and lack of sufficient data are one of the most common challenges that are faced when it comes to healthcare evaluation. Alongside that, privacy and confidentiality concerns, limited funding and staff, and difficulties measuring long-term outcomes can arise in healthcare evaluation. Public health information systems are what allows healthcare evaluation to happen. Public health information systems collect health data, store and manage information, analyze health trends, and support public health decision-making. Without these systems, there is no way to gather and store the data that we are collecting, and there's no way to assess it for trends, and then to use that data in order to improve our outcomes and our policies. Some of the population health indicators that we notice when analyzing public health information is disease prevalence, mortality rates, vaccination coverage, and healthcare utilization. All of these can point us in the right direction when it comes to improving our policies and implementing new changes. The Irish context. The Health Protection Surveillance Centre is Ireland's specialist service for the surveillance of communicable diseases. Data and evidence are highly valued in Irish healthcare. Public health information systems support monitoring of outcomes and quality. One of the recent examples of this is the changes that were made to the 2026 CPGs, or Clinical Practice Guidelines, for emergency medical technicians. These CPGs were changed in order to provide new guidance for pre-hospital emergency care practitioners about things such as stroke or cardiac arrest, as well as providing a wider scope of medications to be used. These changes were made based on new research that highlighted gaps in what we could be doing for our patients pre-hospital. This is a perfect example of how healthcare evaluation not only shapes policies and practice guidelines, but also allows for healthcare practitioners to deliver the highest quality of care that is possible at the time.